Hello, everyone. Today we are here with Dr. John McMichael, the inventor of the CODE molecular formulas that our brand is based off of. And we'd like to have a little conversation with you today, telling you how we got started and a little bit of background. If you've heard the story of how CODE began, you would know that the antiviral formula saved my life. So, Dr. John, would you mind telling us a little bit about how you came across the antiviral formula and the clinical research that you've been doing with it back during the pandemic?
Yes, I'd be glad to. The interesting thing about the antiviral is it was all a mistake. No, not really. But what happened was there was a physician in Alabama who had shown that he could turn off flu symptoms by using a tiny amount of the flu vaccine. Kind of interesting, but didn't make any sense. So he invited me down to his office and spent a few days there watching his patients, and they were getting better dramatically. Within a matter of minutes, symptoms would be relieved, but it still didn't make any sense. So we went back to our lab to find out why that was happening. And what we found was that the preservative in the flu vaccine was actually the active ingredient in what he was seeing. And so we isolated the preservative, got it to the right concentration, tried it on a variety of viruses, and found that we could turn off viral infection. We started with the herpes families of viruses, and then the true influenzas, the ones that knock you out for 7 to 10 days. And then we've done FDA studies on other viruses and found in both humans and animals that we had pretty good luck. And of interest is the same molecule at the same concentration works with a pretty broad spectrum of viruses in humans and animals. So there's no relationship, for example, between the weight of a horse and the weight of a rabbit. If the horse and the rabbit each have a herpes virus, we use the same medicine, the same dose, same results. It doesn't work for all viruses, but there are quite a few for which it does work. We've never seen adverse effects. We've done 3 or 4 FDA what are called phase 2 trials, and they've been successful. But that's the whole nutshell.
That's incredible.
And with COVID, frankly, neither our group nor anybody else had any experience with COVID, but there were no shortage of patients. So we said, let's just try a few. It worked.
It worked for me.
Yeah, it worked for a while.
Thank you for that.
Glad to do it.